Hey there!
Hello!
Skin Tea here, and we're up with another episode. And what are we going to talk about today?
So today we are exploring the fears in the aesthetic medicine field. So that's what we're going to talk about today.
Yeah.
The fears are so many. So we thought it's good to just give you a bit of introduction, to just quiet down the fears that you have about this field that you're in.
And of course, if you have more fears, please let us know and we can discuss about them later. But we're just going to cut down to the ones we thought that are really important for you guys to kind of like sit on and just, further understand the aesthetic space.
You can start us off. What's the major fear that we know, especially, and we're talking about especially the African
in the African
setting,
context,
because aesthetic medicine is now slowly growing here. So what's the main fear you've had among your patients or your friends?
I think the first one is that there's no safe African aesthetic doctor. I think that's the one. So I feel like in this space we have to constantly like prove ourselves that we know what we're doing, that we're well trained, and I like to say, okay, given. There are some who aren't well trained, but I feel like there are resources we now have that can enable you to do your due diligence, to find out who's qualified, who's licensed, and you can ask these questions.
So it means that's a misconception, really. We actually do have safe and qualified aesthetic doctors and practitioners, because we also have nurses in this field and surgeons.
Exactly.
They're there, yes. So it's for you to make sure you do your research and get the perfect doctor or practitioner for you. So,
And like, I feel like also it's your responsibility to educate on yourself on the treatment before you go for it, and then go ask the questions. And if they don't answer the way you'd like, then you just say, no, I just don't want you to touch my face, and that's okay, and you go find another doctor, right?
That's the importance of advocacy. Even for patients, you need to advocate for yourself. Do your research before you go to the doctor. Then when you go there, make sure by the time you leave that seat, you feel confident.
Exactly.
That what you've been told, from the side effects to how long it will take, everything has been cleared up for you. But all we are saying is the misconception that there are no safe practitioners in Kenya in medical aesthetics is false. We are here, and there's so many more of us. But it is a genuine fear, especially when you come to the African side, because it's new.
It's new.
It's starting,
it's a new space.
It's actually a legit fear. I myself would be
me too.
Scared, and again, we're talking about the face. This is what people see when you walk, so you don't want to go somewhere then the next day you can't even leave your house for weeks.
Okay. But I trust you in my face.
I'm gonna touch up your face.
Thank you. Wait, are you saying I need it?
No.
Oh, okay. Okay, thank you. Okay, then you can go on the next one.
Then I think the second fear of judgment. What will people say?
That's a big one.
That's a big one. When you go to the culture, just the culture, the African culture, you can compare it with the West kind of culture. So here, it's less acceptable. Because of little knowledge. So even, I know you've experienced this, you might have patients who don't even want their friends to know. Husband
to know.
No one should know what I'm doing. They don't even want, they want your clinic to also be, in a nice,
very
private
secluded
place. Because there's a lot of judgment. And we see it on social media every day. The Kardashians every other day are just being bullied.
For the treatments they're getting.
Something that they want to do to make themselves feel good
better
about themselves.
Thing is, I do agree, like, if you don't want to talk about it, you don't have to, right? And I feel like there are treatments you can get where it's not, especially if you go to a good doctor, you will look normal, you will look like yourself, maybe just a bit rejuvenated. Fair enough, you can keep it to yourself. But I feel like if it shouldn't be a reason for you not to get it because you're scared about what someone else will say, right? If you want to make yourself feel good, look good, I mean, do it. If someone is like, you look a bit, be like, I take care of myself. You don't have to give the details.
But again,
until you're ready.
And I think this fear, what connects this fear is most people just assume if someone is going into an aesthetic center, it's for a very vain thing. We need to remember that some people are actually coming with real life, real medical problems, real medical issues, but they can't even share it because someone will be like, oh, so you did Botox just because you feel your eyebrow is a bit high. It's making that person feel uncomfortable. They're sweating.
I don't think we should judge anyone about their insecurities. Just because you don't think it should be an insecurity doesn't mean
it's not for the next person.
It's not for the next person. Yeah,
and we all have insecurities. Even the people who judge have things that they would like to improve or change.
Exactly.
So that shouldn't stop you from taking up any aesthetic treatments.
Yeah. And don't do it as well because you feel like everybody else is doing it, so there's also that side of things. Do it because you want it and it's for yourself, not for any other person but yourself, right?
That way you're even more confident.
Yeah, exactly.
You can even just tell someone, I did that and they look good. Don't you like it?
Exactly. And we move on.
Then on to the next one. And I think this one is also valid. Side effects of medical aesthetic treatments.
Very valid. Very valid.
As any medical procedure, you can expect some side effects. This comes from surgery, basic medication from Panadol, and then now all the way to aesthetic medicine with all the treatments we do, our injectables, our lasers, our chemical pills. You can expect some side effects. But which doctor are you seeing? Where are you going? Did your doctor let you know that you can have these expected ones or non-expected ones? Do you have that information? Because that also helps calm your mind before you go for your procedure. What do you think?
I feel like also never be rushed to do a procedure, right? Again, every procedure should be done with informed consent. And if it needs you to go sit on it for a couple of weeks, even a month, you can literally even take a year before you decide even to do the most simplest procedure. But at least you're aware of what could go wrong. You've thought about it and you're like, you know what? I will just, go for it. Don't feel rushed. And I feel like if you're in a space where you feel like the doctor is forcing you to take a procedure or whichever medical practitioner is touching your face, I'd be a bit I'd be out the door on that one.
In aesthetics or even in surgery, consent is important. Either informed consent or signed consent. It's up to you. It's your decision.
Exactly.
No doctor, even just out of aesthetics, any field of medicine, no doctor or practitioner should force you into a procedure. But then again, let's say a side effect
does happen.
Because sometimes things happen. It could happen. Your practitioner, now that's where it comes in. If you're with a qualified, well-trained practitioner, they'll be able to handle and manage this side effect. So they're not side effects that can't be managed or handled. But you'll be walking around looking weird.
And also, sometimes you have to be aware the side effect is not because of the doctor or the product. It's also because you also didn't follow instructions. So you also have to,
follow the post-care. Post-treatment care is very important. That's when things go wrong.
Especially with like injectables. If a doctor is telling you for that whole 24 hours, don't put sunscreen on, don't put makeup on, and you go ahead and do it, you'll get an infection. You get what I mean?
Or for your Botox.
Exactly.
Don't rub, you go and rub. Don't go to the gym, you go
to the gym.
And the most important thing most patients forget, sunscreen. Because for most of these treatments that we do will increase the sensitivity of your skin to the sun. So, and also the information you give your doctor. If you know you're going to a coastal region or a sunny place,
and you don't say
after your treatment, and you've not said, I come and do this chemical peel on you, then you go to Mombasa. What we'll see after, we both won't like
it.
So it's I think it's an interaction between the doctor.
There has to be transparency both ways.
Communication. That's the only way you can be able to
maneuver through this.
Before they happen.
And even if you get it aside, don't panic. Call your practitioner and then talk through it. And also your practitioner should be able, if they're not in a position to handle it, they should also be able to refer you to the appropriate doctor to do it. So that's where the transparency still comes in.
A case that's very difficult, just call Sharlene. Like, what do you think? Do you think you can? And I think doctors need not to be so overambitious, because that's another thing where side effects will happen. You know, you've not done a treatment before, you're not very comfortable with it. And
just say you don't know.
You go in and you go in aggressively, then it becomes complicated.
So appreciate if your doctor actually tells you like, this I cannot manage, let me refer you to somebody else.
That's the best doctor.
Very safe doctor who has you in mind over their pockets. So that's a good thing.
That part.
Right? I think the other fear that a lot of people have would be expectations, right? I feel like there are people who kind of have this fear of maybe the treatment will make me look like everybody else. Like with the fillers, right? When everybody thinks about lip filler, they think of like the huge dark lips. No, it doesn't have to look like that. Or with the Botox, with the very frozen look and things like that. So I think there's a fear in like having that type of aesthetic of that.
Also in that expectation of the results, some patients want very quick results. They come in thinking this is a quick fix. You've had melasma for 3 years, but you think that one treatment will take away. So the expectation again that you become disappointed because you've done one treatment, there's no change. Because you always thought this is a quick fix.
And honestly, not everyone is going to take to the treatment as like somebody else, right? It could have worked for somebody else, but then you tried it and no results. It's okay. You just sit down, re-strategize and try something else. I think so. That's also a reality that people have to go into aesthetics with, that it's not magic.
We don't perform magic here.
And everybody's skin is different. Everybody's face is different. So what worked for the other person doesn't necessarily mean it will work for you. And I think also with the whole situation of looking like everybody else, I think sometimes people come in with like a picture and be like, I want these kind of lips. But I feel like sometimes we'll see your face and we're like, those lips with that face, with like your face structure.
That's actually important. Because there's something called facial
balancing.
There's a point where your cheeks should be at, your chin, your lips, they're proportions to the face. And then you bring a photo. For me, I'll look at Sharlene and be like, okay, the proportion here. Because there are angles, there are things we do. We take some angles to measure before, just to see. So you might want to look some way, but your natural facial structure
will not work with what you're asking for.
And then looking worse.
But then there's some patients who are like, no, I would still want it that way. And then you'll end up getting it done and then you'll be like, oh my gosh, I look weird. But it's like,
then it becomes
we try to tell you.
So I think in terms of medical aesthetics, our treatments need patience.
It does.
Even from your simple skincare, you need patience. You need like 3 months to see some full-time effect. So even for all the other treatments, patience pays. Don't expect that the first treatment will do magic. And that's the difference of surgery and aesthetics. For surgery, you'll be able to now see the difference after you've healed. But in aesthetics,
it takes time.
Multiple treatments.
Patience. Patience. So manage your expectations. That's basically what we're saying.
Always. And I think now this should have even been the first one.
Which one?
The fear that people have about this field, and I've experienced it. Fair enough. The cost of treatment in aesthetic medicine. This one is loaded because part of it's not our fault as either the business owners or the doctors in this field. The rules in the game, insurance claims, that's where most of the issue comes in. Most of your medical procedures will be paid for by your insurance and you'll go and take a claim. But for aesthetics, when it comes to aesthetic medicine, aesthetic surgery, aesthetic dentistry, most of this aesthetics out of pocket, because for the insurance, you're not
sick. Cosmetics,
But that's so unfair.
It is unfair,
people with like severe acne, like there's a lot, even when it comes to weight, there are things that need to be insured because your weight is connected to your health. And it can lead to so many adverse effects with your health. So it's quite unfair, but the costs is another fear. But what do you think about it? Should that stop someone from,
I think,
taking up a service?
Obviously, it can. I think this is definitely something that needs to be talked about in a consultation. I think talk budget with your doctor and say, this is how much I have, and then this is a condition that I have. What is it that I can do within this set amount of money that can help me, right? So you may not even have to go into like the injectables and the lasers, and it could literally just be, just get you a good skincare plan, just really good skincare, like prescription skincare or something like that to kind of help you.
That's actually
I think just talk budget. Don't be ashamed to tell your doctor, this is all I have. And then we just find a way to work with that.
And I think it's because it's just a misconception
it is
in social media, because the most of the treatments in aesthetics that are known are the injectables and the lasers, and they're the ones which cost really high.
But they're affordable ones.
They're affordable ones.
That can still help.
There are other treatment options, and in most consultations, a doctor will give you options. Even when it's a injectable, let's say Botox, there'll be different brands with different costs. Then our treatments are so many. Like your wrinkle can be treated with almost 9 different types of treatment. So we can always choose one that favors your
budget
and your budget.
Exactly.
So don't be ashamed.
Don't be shy.
Don't be shy.
Come to the consultation, and I feel like it's all of us struggle with money, so it's like we get it.
And something that I really like that I see going on in the aesthetic industry, both in Africa and outside, is how practitioners are trying to make that easier for their patients by creating, some packages, that makes
payment plans. You can discuss payment plans with your doctors.
So don't be scared. First, come and find out. There could be actually a payment plan.
We could structure for you. I agree.
Yeah, but all in all, these are some of the fears. But if you have more, kindly comment.
Yeah, for sure.
In our comment section.
Let us know, because I feel like the ones we've encountered from the discussions we've had with certain patients, that's where we summarize these from. But obviously, if you have more,
you can add one?
Tell us. Yeah,
I don't know. We didn't discuss it, but I think we should mention it.
Which one?
Pain. Fear of needles. That's one.
That's me.
That's you. And me, I'm so
scared of needles.
But now after coming to the aesthetics and you do it on your own, our needles are
they're tiny.
They're the tiniest needles.
Yeah, depends
on which procedure. But most of our needles are very tiny, and we numb. You can numb your face before a procedure, so you're literally not feeling anything. But
I hope my face is not showing, but
you have the fear. And
no, but
so now take it from me. Leave Sharlene.
Thank you.
Once you're relaxed and well, and the first one, for the first one, you might feel some discomfort.
Of course.
I'm not saying it's not painful. There's no pain. There's no procedure that won't come with a bit of discomfort. But once you go home, in 24, 48 hours,
actually,
you feel better.
I did PRP for my hair.
How was that? Because you're scared
and then
of needles.
I did like multiple injections. I'm scared of needles.
Was it with a micro needling or with
a needle like injection, right? And I'm deathly afraid of needles, but I sat through it. I've had like 3 pains. I did 2 sessions and it was okay. Although I did have a great doctor. I don't know.
Who also calmed you down before.
He was really good. Reassured me, and he also helped manage the pain as well. So
pain management.
Pain management is a thing.
It's a thing.
I think that was a good addition. Okay. So just let us know your fears, and we're here to kind of walk you through it and reassure you that it's gonna be fine.
And we hope at the end of this video, if you were scared about something, maybe you wanted to consult us or any other doctor, but you're scared. Now you've had something that has reassured you. Don't forget, you can reach out. Always reach out. Feel free. And stick here at Skin Tea. We have so much for you. So always watch our videos. Feel free to like, subscribe, and share. And see you on the next one.
Bye.